National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopath and a health expert here at Nationalnutrition.ca. I often encounter in my practice patients that suffer from dermatitis. Now, dermatitis in and of itself isn't a specific condition. It literally just refers to inflammation or itis of the dermal layer or the skin. So really all dermatitis translates into is inflammation of the skin. It's a way doctors describe a specific presentation of the skin. So there's a couple of different reasons one can have dermatitis, and it's really important to understand the cause because, of course, the cause is going to dictate the appropriate treatment because you're going to, of course, get at the underlying cause of the disease in order to permanently limit the disease. So there's a couple of different reasons you can have dermatitis. So there's atopic dermatitis, which is often referred to as eczema or eczema, and this is typically an allergic type cause behind the dermatitis. And it's typically, I find in my practice, either due to some level of either food sensitivity, food allergy, chemical sensitivity or chemical allergy, or related to some level of infection, often disproportionate number of yeast found in the gut. And what's happening is the skin is being used as a detoxification system because it is one of the largest detox organs in the body. And because of the types of chemicals or the types of reactants that it's excreting, that's creating inflammation of the skin, and that leads to the development of atopic dermatitis or eczema. Then there's also what we call contact dermatitis, and this is typically inflammation of the skin that comes from contact with a variety of different things, usually chemical in nature. One of the most common or the easiest to identify is a latex allergy. So, if you put a latex Band-Aid on a specific part of the skin, you would see a Band-Aid shaped patch of dermatitis. That's very easy to identify as true contact dermatitis. Other common causes of contact dermatitis tend to be things like laundry detergents. So some laundry detergents with certain chemicals may irritate certain people, and what you'll find is the rash occurs at areas where only the clothing touches. And so, of course, you can link that back to being related to the laundry detergent. But contact dermatitis, not just from detergents, it can be any chemical that when your skin is exposed to it, it creates an inflammation state. Some people even have what we call a metal allergy. So certain metals can actually trigger the response. So I've seen people with dermatitis, at their lower abdomen, and it's related actually to contact with a belt buckle or sometimes the button on their jeans. That kind of thing can even cause dermatitis of the contact nature. And then the other types of dermatitis are seborrheic dermatitis, which is sometimes referred to as cradle cap in children. And what seborrheic dermatitis is dermatitis or inflammation caused by a fungal infection. And so when you have seborrheic dermatitis, it's an overgrowth of a certain fungus that's on the skin, and that leads to the inflammation of that skin area. So treatment obviously is going to depend on the cause, and so we're going to talk about obviously avoiding the triggers, the food triggers, if there are food triggers for atopic dermatitis or eczema. You're going to want to focus on eliminating exposure to anything that may cause contact dermatitis. And then if you have seborrheic dermatitis, the approach is going to be much more directed at treating the underlying fungal infection. So in that case, you might want to use tea tree oil or neem oil topically. There's actually a variety of different things you can use topically to try and get the seborrheic dermatitis under control. Now, managing the inflammation is also important. So once the eczema is presented, it may take some time for it to go away. And of course, it can be itchy, it can be painful, the skin can crack. So if you've got this dermatitis, you're going to want to help manage the symptoms of it. Typically, I often like moisturizing those areas of inflammation with anti-inflammatory oils, using things like coconut oil, shea butter, olive oil. Those things can all be very effective at helping to limit the inflammation of the area. And then often using things like vitamin A and vitamin E topically in those areas just to help the body speed the healing a little bit. And then if it really is getting out of control, there's always the option of going and speaking with your medical doctor about using a topical corticosteroid. all that does is it limits inflammation. It doesn't actually treat any of the underlying cause of the condition. What it's going to do is it's just going to help bring the inflammation down, and that can be helpful in severe cases just to make somebody more comfortable, especially while you're trying to understand the cause of your dermatitis in the first place, because it can be very complicated, especially if you have a multifactorial dermatitis. So of course things get complex when there's contact dermatitis paired with a food allergy causing dermatitis or eczema, and then also paired with some level of infection, in which case you've got three things creating a dermatitis state, and of course trying to identify all of those is going to take some time. So corticosteroids can be effective short term. The one thing you need to understand with them is they can hide the symptoms of an infection of that area. They can cause thinning of the skin, and long-term use, they can make you susceptible to certain infections. So there are certain risks associated with their use, especially their long-term use. So just be aware of that when making a decision about which type of care is best for you. So I hope these tips will help you manage your dermatitis. Check out more of our natural health videos at our channel, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.